Сайн байна уу? Намайг Гантsooj гэдэг би Монгол улсаас ирсэн. Энэ дээрээ 2 сар болж байна. Миний өвчин болохоор цусны цочмог харт авдар. Хамгийн анх 2023 онд онцлогдоод Монголдо эмчлэгдэж байгаад эмчилгээгүй болоод байж Мэт болон Жүти 2 Монголд ирээд цусны өвчтөй хүмүүсийг үзэж байхад нь би үзүүлээд нэгтгэх улсын Marengo эмнэлэгт эмчлүүлэх боломжтой гэсэн мэдээг хүлээж аваад эмчлүүлэхээр ирсэн. Тэгэд энд ирээд одоо нэг 2 сар гарсан болж эмчлэгээ дууссан.
Мэт эмч болон мэт эмчийн багийн хамтлагын болон Marengo им маш баярлалаа.
Hello
friends, I am Dr. Meet Kumar and I am a hematologist and a bone marrow transplant physician at Marengo Asia Hospital, Gurugram and Faridabad in northern part of India. Today you heard about a very interesting patient whom we treated recently. He is from Mongolia, from Ulaanbaatar. He was diagnosed to have a condition called severe aplastic anemia way back in 2020. At that point of time, he was treated with certain medicines called ATG and cyclosporin that he received for almost 1.5 years. After that, he was noticeably benefited by this treatment and he was comparatively well without any requirement for blood transfusion for the next 2 years until April 2023, that is last year, when he developed complaints of pancytopenia. That is, his hemoglobin went down, his WBC went down, his platelets went down, he required blood transfusion. He was evaluated again in Ulaanbaatar and he was confirmed to have acute myeloid leukemia. That's a type of blood cancer. So, his aplastic anemia, this time when the disease came, it was not aplastic anemia but it had progressed to acute myeloid leukemia. Whether it is a natural course, whether it has progressed from aplastic anemia to acute myeloid leukemia, or it is because of the ATG, that remains a question. But yes, his disease changed paths and came back in the form of acute myeloid leukemia. He received his initial part of the treatment including chemotherapy by the doctors in Mongolia, and for the further treatment of bone marrow transplant as the curative treatment, he came to us for the same. He was admitted here for almost 3 weeks. He underwent a matched sibling donor transplant with his sister as the donor, and now he is almost completing more than 2 months of the transplant period, the most critical phase of the transplant period. He has completed here. He did not have any significant complications other than some minor grade 1 graft versus host disease, some minor CMV reactivation that can be controlled with simpler medications, and now he is fit to go back. He has completed his day 60 bone marrow test and the chimerism and the MRD. He is doing absolutely fine, and we wish him a great luck and possibly a life that will be free of any of hematological problems, be it be aplastic anemia, be it be acute myeloid leukemia, or any other problem in the near and distant future. So we at Marengo Asia Hospitals, Gurugram and Faridabad are committed to develop the super specialty focuses on all transplants, especially on bone marrow transplant, and we are doing all cutting edge treatments that are required for catering such high risk patients, and that is our strength. Patient first is our approach, and we continue to strive to improvise ourselves to do best thing and justice to our patients. Thank you.